How many Canadians die each year while waiting for surgery from our government-run healthcare system? Our new report gathered government data on this very topic. We examined this issue because it's a sad reality that Canada's government-run healthcare system sees some patients die each year while waiting for surgery. In 2016, Laura Hillier's tragic story earned national attention. The 18-year-old Ontario student was fighting cancer and had a bone marrow donor lined up. Sadly, the government had only funded 5 procedures per month at her local hospital. That meant Laura had to wait. After 7 months of waiting, she passed away. The Toronto Star noted the cancer she was fighting was beatable, but instead, for 7 excruciating months until her death on January 20th, the teenager bore witness to one of the province's most devastating healthcare secrets and died trying to do something about it. We know about Laura's story not because the government brought it to light, but because her call for help went viral on social media. SecondStreet.org wanted to know how many other Laura Hilliers are out there. How many other patients are dying while they wait for the government to provide surgery? We filed Freedom of Information requests with 50 government hospitals and health regions in Canada, asking for data on how many surgeries were canceled in 2018 to 2019 because the patient had passed away. The data provided to us showed us that 1,480 patients died while waiting for surgery that year. The hospitals that provided that data only cover less than half of Canada's population. The real number is probably closer to 4,000. Patient waiting periods ranged from less than a month to over 8 years. In many cases, patients waited longer than the medically recommended time frame. To be clear, the data that we uncovered was not just for life-saving surgeries such as cancer treatment, heart operations, and so forth. This data also includes cases where patients died while waiting for surgery that affected their quality of life, such as hip operations, knee operations, and many other surgeries. Would you want to spend the final year or 2 of your life stuck in your home because your hip pain made it too difficult for you to move? Or maybe your vision was cloudy because of your cataract problem. Here's one example of a response we received from the Nova Scotia government. This page shows people who were supposed to receive cataract surgery within 91 days, yet many ended up waiting for more than a year before they passed away. Some waited 2 years, some even 3 years before they passed away. The government also noted 25 of all deaths on the waiting list involved procedures where delays in treatment might reasonably be implicated causally. Among these are bowel resections, angioplasty, pacemaker insertion, cancer resections, and abdominal aneurysm surgery. Among these, just over half were waiting beyond the recommended wait times for the procedure in question. Nova Scotia at least knows what's going on. Data from most other provinces was far worse. Many hospitals told us they don't even track the number of patients who die while waiting for surgery. Consider that many governments will make businesses report on minor workplace accidents. In British Columbia, for example, the government notes on their website that a worker was injured at work, resulting in bruising. Yet when it comes to government reporting, they don't even report on patient suffering, let alone bruising. Imagine if governments held themselves to the same standard and reported on patient suffering. That would be the first policy option. The second option would be for governments to give patients a choice. Keep the public healthcare system, but allow patients to also consider going to a private health clinic for surgery. This option is available to citizens in virtually every other industrialized country on Earth. This would not only give patients more choice, but it also takes some of the pressure off the public healthcare system, as some patients would decide to pay out of pocket for it. This option would also save lives. You can read more about this in our new report at secondstreet.org, and if you like what we do, please consider a donation.